Hi, it's Don from LivedHealth again, and I'm here with Professor Elias Sotirchos from Johns Hopkins University in the United States. And it's a very quick discussion about NfLs. Now, if you don't know what NfLs are, you don't have to. They're neurofilament light chains, and essentially it's something really clever in the blood. But the super important thing, I think, as a patient, is this is one of the first times doctors will be able to answer the question better, what's going to happen to me? So if I'm sitting in front of you and you've told me I've got MS and I ask you what's going to happen, what are the tools you have today to help me understand how things are going to turn out for me, not in general, but...
Yeah, I think that's a great question. And the short answer is that we can't say 100% what's going to happen to one person. So there are a lot of unknowns. But when I see the person sitting in front of me, I try to take into account a variety of factors. And so there are a variety of factors that have been associated with a potential worse or better clinical course, including how somebody presented, how long they've had the disease, at what age it started, male or female, comorbidities as well.
If I smoke, if I'm overweight, if I don't exercise.
Things like that have been shown to be associated with worse MS disease course. So there are a lot of things that kind of go into that potential, and there's a lot of variability in multiple sclerosis.
Doctor, I've heard about NfLs. What are they?
Yeah, so NfLs are proteins that are within nerves in the brain and spinal cord, as well as other nerves in the body, and they're released when a nerve is damaged. And now the technology has kind of gotten to the point that we're actually able to measure neurofilaments in the blood of people.
So no
spinal tap, just the blood draw in order to measure them.
Like I always get stabbed and give blood.
Yeah, so we'd be able to just check this in addition to all the other tests that we get on a routine basis.
And that gives you an indication of what might be happening or might be going to happen to me. Is that fair?
Yes, so the data supports that if that neurofilament light chain value in the blood is elevated, that can be associated with a potentially higher risk of disability progression, brain atrophy, and relapses in the future. However, I think that it's important that it seems that its role is not only to predict that something's going to happen, but also to identify people who how well their treatment is working and whether they would benefit from a more kind of different disease-modifying therapy.
I'm on a mid-tier drug, but there's actually evidence in the NfLs that possibly you want to put me onto a higher tier drug.
Possibly, but again, I wouldn't do it taking into account the NFL in isolation.
They make part of the picture, don't they?
Together, it makes part of the picture. So that's, I think, an important point, that everything is kind of putting together pieces of a puzzle, and part of the puzzle is the MRI, part of the puzzle is the neurologic exam and how somebody is doing. And I think that the NFL is going to be very useful to be neurofilaments, an additional part of that puzzle that will allow us to put the picture together in a more complete sense. I'm not sure that we're there yet to be using it in daily practice, but I am very hopeful that in the short-term future that we will, with more studies, be able to better interpret these levels and use them in order to counsel and to make decisions in daily practice for people with multiple sclerosis.
I think you read my mind, because that was my next question, and I think everybody wants to know when, especially from a patient's point of view, it always seems to be sort of manana, tomorrow, yeah, nearly there. If you were going to put a number roughly, 1 year, 5 years, 10 years, when I'm sitting in front of you, my doctor, and you're saying, Dominic, we're also testing for neurofilaments because they provide us with a certain subset of information. When am I likely to be hearing that?
I think that's a really tough question, and I don't want you to pin me down on a specific time point. I think one of the questions right here was about a discussion people were having about 2 years ago, saying that it would be ready today, and now I'm saying it's not ready today. But I do think that it is a matter. It is less than a decade, I would say.
Right, okay.
And I do think that under 10 years, and there are other promising biomarkers as well that can be measured in the blood, not just NFL, like we heard today about another one called GFAP. And I do think that there are potential other biomarkers in the blood that can be measured that might be complementary to the neurofilament light chain, just another piece of the puzzle that can allow us to complete that picture.
I was saying, you've got AI and MRI, you've got NfLs, you've got optical coherence tomography, the OCT, flash your name for that thing at the optician that blinds you and then looks like a supermarket scanner on your eye. But it's actually looking at the thickness around your retinal nerve fiber, and it tells, again, it helps you build a picture, doesn't it?
Yeah, exactly.
Look, I really appreciate you. Thank you. I know we doorstepped you, so thank you for taking the time.
Very nice. Very nice.
Cool. All right, thanks, people.
LivedHealth will be bringing you on-the-day highlights from Europe's biggest annual MS conference, ECTRIMS 2022. Make sure you're subscribed so that you don't miss out on the latest updates in MS treatment from across the globe.